Hey there, in today's video I want to share a little bit about this particular scan. This is a patient who presented to the office just for a routine checkup and evaluation. You can see she's got a lot going on here. A very, very deep bite and a big overjet as well. So lots to talk about here. Certainly there's some skeletal issues from an orthodontic standpoint. One of her primary concerns was this little divot on the facial of tooth number 9, which I think is abfraction related. I'm sorry, tooth number 8. As you can see, she's got some heavy abfractions here in multiple areas, likely related to how her bite comes together. You can see she's got an inside bite here on the left side, more normal on the right, but quite a bit going on here. So through the process of doing the exam, we treatment implanted crowns on both of these teeth. Priority for me was working here on tooth number 30. This one, in my opinion, seemed to be the one that would be the biggest problem the soonest, with multiple fractures and some obvious recurrent decay in multiple areas. So we treatment implanted crown on that one. And then we also treatment implanted crown on the lower left. For the same reason, but it didn't seem to be quite as urgent, so we put that one second on the list, although it's definitely in need of some attention, just like the other side is. So she's obviously got some crown work before. We did these two crowns, and for any of you who've been following my YouTube channel, you'll know I've been using the Bruxer Glidewell IO milling solution, and it's been great. These are both from that machine. I've been very pleased with the outcome. The process is very simple. The AI does most of the design work for you. This has been great to use. So we do the same for those lowers. So let's talk a little bit about the orthodontic situation. You know, I've been doing straight wire brackets and wires since graduating dental school and a little bit in dental school in 2006. Haven't done it in a little bit. Transitioned mostly to InvisAlign, but I'm not afraid of straight brackets and wires, or straight wires and brackets. The question is, do you think this case is doable with InvisAlign? Now, I think doable is a relative term. It kind of depends on what your outcomes are. If you're looking for a perfect AP correction and an ideal alignment to class 1 and all that stuff, I don't know that that's doable without major surgery and, you know, months or years worth of recovery and orthodontics of some type. But if we're looking for a nice cosmetic outcome, absolutely this is doable with InvisAlign. I mean, I really think this would be a great opportunity for this particular patient. And so we talked with her about it. You know, I think her anteriors, we're going to be able to bring those back into alignment very, very nicely. Even with the deep crowding that she's got, heavy crowding that she's got, very little interproximal reduction is required. We're going to be doing about 0.5 millimeters in between each of these upper premolars, the canines and back, to allow for some spacing to allow these teeth to line up. I'm in the middle of some refinement ClinCheck with InvisAlign. I'm getting a good ClinCheck that I'm happy with. We're working on the third round. They tried to close this a little bit and it moved the midline over to the patient's left. So I've asked them to leave that space open. We'll talk about an implant or a bridge down the road. I'm looking for a better orthodontic outcome now. For this patient, really her concern was cosmetics. So, you know, her laterals are kind of catching her lip, but cosmetics was her main concern. So we treatment plan to filling, comprehensive InvisAlign ortho, 2 crowns, and it's gonna, in the end, I think it's gonna be great. I'll do my best to kind of track her progress here, this InvisAlign progress, maybe with a later video. But one thing, I've been very, very pleased with the MLS template that I had a chance to go through, the MLS coaching, the MOLIS coaching. The MLS template's given us great proposals, and I'm having to do very little, a lot less than I used to have to do with InvisAlign from the standpoint of ClinCheck input. The proposals are coming back really, really great. So that's what I've got for you. Thanks for watching.